Established in the year 2015, Rose Zambia is an organization that works to deliver a world where adolescent sexual reproductive health is made a priority. The organization was established with a mission to make a difference in the lives of women and girls by educating them about their sexual and reproductive health and rights and responsibilities, so that they may exhibit autonomy in order to reach their full potential and be effective leaders and agents of change in their communities. We envisioned a world in which every woman, girl, and young person is happy, healthy, and living to their full potential.
We have had a fair share of challenges. There have been different challenges at different stages of our growth. I would say the first 3 to 4 years, the biggest challenge was funding. Raising funds in a country like Zambia, doing the work that we're doing has been a challenge, especially when you're a young person, because the way that the sector works is you are given funding based on the funding that you already have. So say your seed funding was $5,000. You can only be given up to 50% of what you already have. So now being able to convince other people, being able to have other people, other donors trust you and trust the work that you're doing and see the fruits of your work was very, very difficult. But with the team supporting and with just the passion that we've had from the beginning, we've been able to make some strides in that area.
In the last 8 years, Rose Zambia has not only seen an increase in the number of projects, but also an expansion in its geographical coverage to 8 of 10 provinces in Zambia. The organization now has 2 offices, one in Lusaka and the other in Kitwe on the Copperbelt province, with over 40 staff on full-time employment.
The skills I've learned throughout my journey with Rose Zambia: people management skills, financial management skills, budget tracking, cash flow, and lastly, payroll management skills. These skills have not only improved my career life, but also my personal life.
So I have had many pivotal experiences. The first one was when I was a volunteer and I had to talk about rape culture to a group of grade 7s at a school in the community. So when I went in, almost the whole entire class was convinced that when a girl is dressed indecently, it is her fault when she gets raped. Going through the session on rape culture and seeing their minds or their misconceptions or their understanding of rape culture change from blaming the victim to understanding that the problem is the perpetrator was one of the most impactful moments for me.
Over the years, Rose Zambia has implemented multiple projects, among them Youth Care, USAID controlling HIV epidemic for key and underserved populations, USAID Momentum Country and Global Leadership, USAID Family Health and Nutrition, Health Action for Adolescents and Young People in Zambia, Sexual Reproductive Health Awareness Project, the Zambia University Pregnancy Prevention Initiative, the Generation Equality Zambia Project, the Candid Pride Project, and the Youth Engagement and Advocacy through our youth hubs. During the implementation of the multiple projects we have worked on, Rose Zambia has worked with various stakeholders and partners, including different ministries, local and international donors and organizations, communities, and volunteers among them.
Rose Zambia is one of our sub-partners that we have been working with since the inception of our project in 2021. This is a special partnership where we know that Rose Zambia has been focusing on adolescent health, and being a local organization, a youth organization, we have partnered with Rose with that added advantage of them being on the ground locally. So we came together to work on this project, knowing that they were going to bring on board that partnership that is going to address issues of adolescents in the reproductive, maternal, newborn, child, adolescent health and nutrition services in Zambia.
So with Rose, we've received a number of support, which as a facility we are very pleased Yes, they've supported us in terms of supplies. So we've received supplies like condoms that the youth distribute in our community. We've also received a number of trainings, both for our adolescents as well as for members of staff. Then besides the training, we also receive financial support for our adolescents. So we have weekly and monthly outreaches. Those are supported by Rose. Then besides that, they support our adolescents with the refreshments and snacks every time they have their meetings. So we normally have support groups over the weekends.
Here are some of the key highlights from our work in the past years. The Health Action for Adolescents and Young People in Zambia, the HAZE project, was implemented by Rose Zambia in partnership with Action Aid Zambia in Mazabuka, Petauke, and Lusaka districts. The overall objective of the project was to improve adolescent and young people's access to sexual reproductive health and rights.
So after I was truant in SAP under Rose, it really motivated me to kwanisa kienda field na pulsa adolescents anza tupani teen pregnancies, early marriages, substance abuse, and self-abortion. We were able to conduct radio programs at least information yatwazi bakutali bakutisanga kwanisa kubafika wenzombera information through radio programs.
Ini benefit enatengamu number one benefit inankhala na knowledge yakwati nikaenda mkomoni or even mu community wendo ponsa abantu ningankhale abantu bose bangachite understand inatitandiza fruit as educators kuziwa ma rights yasu nawo tinaziwa tiwa no tina ma rights yofunika kusangana no the ma rights yonkhala educated. It's because of this organization Rose. Ina pamene mnasebenza ko ija time mnasebenza inapezeka kuti ma numbers of teenage pregnant yonse yabwerera ku down. Early marriages bambiri bantu babwerera ku maskulu, which is important.
The USAID Controlling HIV Epidemic for Key and Underserved Populations, CHEKUP 1, is a 5-year project being implemented in 5 districts, namely Lusaka, Kitwe, Chingola, Mufulira, and Luansha. Rose Zambia is implementing the school-based prevention intervention and the coaching boys into men activities on the projects, which are aimed at behavioral change, increasing knowledge on HIV, and preventing new HIV infections among adolescent girls, boys, young women, and men.
So my work basically involves having sessions with adolescents and the young women and men, talking about HIV mostly and anti-GBV. So the project is about reducing HIV rate among the key population, which are the people that I usually work with. So far, the work has been moving so well. It has been a joy working with kids, interacting with the young people, learning from them and empowering them with the right information.
So kuno timapunisa pola mamolos. Timapunisa bana wana niezi kukapo 14 years. Mostly behave in society na mground, wakanda ku school mostly behave. So timapunisa bana timapunisa mamolos. For example, kulia self-personal responsibility. Akaenda kunyumba mwana ngatwasha, afunika yeye kaziba kusuka mkamwa, kusuka mamba, isafu ndali mapalisi wa muzi. For example, ndio zinye, kasanga ndati wa mai wapoira, afunika even, akontrol ni mamuna. Kupianga, afunika apianga, nutia ya mkaza apianga. China watima polisa mcommunity mwatima enda. Mpinga tuwa na mutaponya po wakazi, aponya pa kumiso ipa kwa wakazi. Afunika na ipa tanizapo, angena. Mgati na wakulu maningi, awazokuwa ntu wakuta, mutamba wakazi, tataniza. Tawakaza maningi, tawalike ili atima study meaning, tuwase na rate. But tima ya wala wakazi na even watimungai. But also stay na even wachita.
Menstrual health management was one of the flagship programs for the organization. And Rose Zambia has in the last 8 years worked to improve menstrual health hygiene outcomes for women and girls by offering menstrual health education, trainings, and product distribution programs to normalize and increase awareness of menstrual health management, as well as foster greater acceptance of menstrual health hygiene practices. We are proud to share that we have distributed over 100,000 sanitary napkins across the country, developed menstrual hygiene management training and IEC materials, as well as empowered various individuals, organizations, and communities with skills and information on menstrual health management.
So I remember having that conversation with Dr. Natasha, and she just gave me her blessing. I said, you know what, Annie, if you feel you need to do this, to teach the girls how to make these pads, please go to that village and teach them. The more hands we have on deck, the better we're going to be closing the gap to end period poverty. She helped me with some sanitary products, disposable and reusable pads, and the fact that I'd already gained the skill from the workshop, it was easy for me to go to my village and do what I had to do. And when I went to my village in Mukuni village, we were expecting to have 200 girls, but we had 300 girls present at the event. We took some poppers from Papa Rose, the pads that she gave us, and the money that I had at the time, and we had the female chieftainess present, known as the Betiambo. And after this activity, we were able to see the joy that the girls had in learning these skills. So that's how much of an impact it has had on me. And just with that experience, because of her and us having Whisper Your Dream Foundation, we've been able to reach out to 6,800 girls Zambia-wide with just simple advice from one woman. That's how much impact she's had on me and the organization that I'm running today.
Rose Zambia is currently running 2 youth hubs in Lusaka and Copperbelt provinces. The youth hubs were launched in 2021 and 2022 respectively as a safe, fun and skills development space for adolescents and young people. Through the youth hubs, we have been conducting skills development and mentorship sessions, school activation sessions, and counseling sessions.
I've gained experiences and also the knowledge that I'm able to even share. And being a CRZ beneficiary, I think it has transformed me in a lot of ways. We talk about my society, my community. You know the ghetto, how it is. It's full of people from different traditions and different norms and speculations to say. So it has been quite beneficial to me in such a way that I've learned how to handle different people and how to address different kind of people, and also how to make sure that I live in the social aspect of my fellow peers.
So we, as the young people from Rose Zambia, went into communities, into universities to ensure we give them the right information in relation to pregnancy prevention for young people. So during that project, what we did was community service, a lot of field work, where we had first-hand interaction with people from the communities, people that are not informed. So our duty was to go and give them information. We gave them the services, we provided the knowledge and all those things. Then for me as a young person, I make very good decisions when it comes to pregnancy. When it comes to my sexuality, I make very good decisions because of that program.
The Generation Equality Project was where I was impacted with the knowledge to advocate for gender equality and feminism, conduct community outreach programs in various schools, marketplaces, shopping malls, just name it.
With the launch of the new strategic plan, our mission is to build a conducive environment for all young people to thrive in all aspects.
The vision of Rose is a world in which young people are happy, healthy, and living to their full potential. And we see this new strategy as an opportunity for us to do more of the work that we love and the work that we've already been doing. With our new strategic goals, we are streamlining because we believe less is more. And so we have 3 main thematic areas, and we want to do exceptionally well in these areas, which is youth development, gender equity, and health and wellness. And so we are hoping to see more impact, and this strategy will just be us putting to paper what we hope to achieve. They say a dream that is written down is 10 times more likely to be achieved than one that isn't. And so our new strategic plan is our dream on paper.
Rose Zambia. Beautiful, valuable, and empowered.